Hi, everybody. Good morning. People is joining now. Okay, so I think that we can start our webinar. So first of all, thank you very much, everybody, for joining us in our first Procure4Health webinar. So this is the first one. We plan to have around 12 webinars related to our 12 insights. And today we are going to focus on the basic of innovation procurement. And I would like to thanks to our colleagues, Innovation Skåne, Björn and Magnus. Thank you very much for being here with us. They are part of our Procure4Health community, and TIC Biomed and Innovation Skåne. We are supporting our organization of this great community of procurers. And allow me to start presenting you the Procure4Health community. So I think that you are seeing my screen. No, I need to share my screen now. Okay, so I'm Maria Bernabé from TIC Biomed, one of the supporting organization of Procure4Health community. And I'm going to introduce you the, I'm going to introduce you the Procure4Health. Our community is the European community of healthcare, social care, innovation procurements. And we launched our community in June 2022 with 19 procurers on board. Now our community is open to new external members. So we are willing to invite you to join our community from now on. So today, I would like to introduce you the benefits of our community. So they are divided in 4 categories, and they are free, completely free. So you have access to all of the services and benefits if you join our community. So they are divided in capacity building, networking and matchmaking, collaborative innovation procurement, and policy impact. So as for the first one, if you join our community, you will have access to a lot of curated resources that will help you to guide on the 8th step of the process of innovation procurement process. So the main objective of this service is to share knowledge and to help you with the capacity building. So you will receive capacitation through mentoring session and tailored training. And also you have free access to a wide range of resources on innovation procurement, all health related. And also through this service, you will have the opportunity to learn from peers and exchange experience via trainings. This we will talk later. My colleague Magnus from Innovation Skåne will talk later about the trainings in more detail. Okay, so Procure4Health provide you, as I mentioned before, an accessible catalog of resources. So this is quite important in our community, because we think that to build capacity, we must you must understand the process of innovation procurement, the different phases and stages of the process. So this catalog will support procurers in taking and upscale the next step in the journey of procurement of an innovation. So you will find in our community several resources, and they are free available for you in the online community. As for the networking and partnership building, you will have the opportunity to participate in discussion group to promote key strategy topics. And as I mentioned before, our Procure4Health community is an active community of public and private healthcare procurers, and they will be connected through a platform. So in this platform, you will be able to create your own profile, to add your organization, participate in working group, discussion forums, webinars, events, and so on. Also, you will have free access to a matchmaking tool where you find peers to share knowledge and to exchange experience. So also the library of resources and the marketplace for innovation challenges. We have established a working group. So we have 4 working groups defined so far in our platform. And you can, once you join the community, you can request for joining the working groups, and I will be more than happy to accept you and approve your request. So they are related to digital healthcare and ICT, sustainability in procurement of innovation, precision and predictive medicine, and integrated care. So this is the 4 ones that are now open and available, and you can join this kind of working groups of your interest. Well, through our community, online community platform, you will also be able to identify common needs for your next innovation procurement project. So we will help you in the preparation of procurement based on common needs, and we will go through the complete phases of the process. As you can see, the need assessment, the market analysis, open market consultation, analysis of innovation procurement. So through the working groups I just mentioned, you will have the opportunity to identify unmet needs, and setting a marketplace on the platform will be done as well. Through Procure4Health community, we will try also to contribute to the European growth policy and strategy via exploring funding STEM to co-finance the procurement of innovation and influence policy at European level on procurement of innovation for health. So we are working on the elaboration and development of a position paper on public procurement policies and sustainable innovation procurement, and also an action plan will be developed for advance in the procurement of innovation process. So now it's time to join our community. So I invite you to join us and to benefit from all the values I just mentioned in the presentation. And I want to note that the registration is free. So all our services are free of charge. So you always need to access our Procure4Health community. I will send you later the link of the webpage, but it's our webpage, Procure4Health. And after that, you have to access to the community section. And there you will find the link to go to the platform to register and join the community. This is the overview of the platform. As you can see in the slide, we have a lot of sections in the platform. You can find news, the latest updates regarding the innovation procurement, the members of the community, organizations, so you can contact with members and start matchmaking with them. And also the events related to the Procure4Health community and regarding innovation procurement will be there in this section. So you will have access to the event and you can register and join us. The working groups, you will find in this platform the 4 working groups that are established so far, and you can join, as I mentioned before, and the capacity building catalog. Here in this part, you will find the resources I mentioned, and several resources related to the different phases of the procurement of innovation. And also you will find the Procure4Health Insight. This is the reason that why we are here today to explain in more detail the Procure4Health Insight. So we launched the first one in our platform and now it's available. You can find it and you can read and download the document. So this is the first one, Basic of Innovation Procurement. And now our colleague Björn will go in depth with this first issue. So thank you very much for your attention. If you have any question, you just need to send me an email and direct email, and I invite you to follow our community through Twitter, LinkedIn, and to visit our website. So thank you very much, everybody. Now the floor is yours, Björn. You can start with your presentation.
Thank you very much, Maria. And now let's see if I just get it in full screen. Now I see my full screen, huh? Great.
Yes.
Great. Yes, my name is Björn Lagnevik, and I'm glad to given this opportunity to share my experience in the field of innovation procurement. I've worked with innovation procurement for almost 15 years. I started off from a strategic perspective, and the question then was, how could we enable Region Skåne to allow innovation for a larger extent? What was the main barriers, and how could we allow small and innovative companies to place an offer? For example, at that time, we demanded that all companies that would like to participate in public procurement had 7 years of experience and economy in balance. And could we or should we change that approach, or how should we tackle the issue? Then I also worked a lot with engaging politicians and top management in order to support more risky procurements. And that was in order to back up the procurer in their everyday work, because they were the ones that actually had to handle the different projects. Later on, I've been involved in national innovation procurement councils, mainly at Vinnova, but also other agencies in Sweden. And there we had a focus on how calls could be designed and what support do public organizations need in order to handle innovation procurement from start to finish. Nowadays, I'm involved in a number of innovation processes in several fields, with the aim to implement new and innovative solutions in Region Skåne, different apartments. So that was a little introduction of me. I'm working at Innovation Skåne, and we are an innovation company owned by Region Skåne, and we contribute to regional growth and public services through innovation. Region Skåne is a self-governing administrative region in the very south of Sweden, and they're responsible for social and medical care, public transportations, and that kind of areas, business development, culture. But this, I would like to start from Innovation Skåne and why I believe that I'm placed on a perfect place in a perfect organization. Because Innovation Skåne's mission is to be oriented in and relevant in the sweet spot where public needs meet solutions developed on the market. So at Innovation Skåne, we both provide business advisory services to startup and support the development of new industries, but we also contribute to development of future public services in Region Skåne's operation through innovation and external collaborations. I think that we are the perfect organization in order to work with innovation procurement. Because we both have this business advisory support function. We work within communities in a number of sectors where we meet both small and medium-sized companies, but also larger companies that participate in different activities. We have a broad reach. Then we are responsible for helping employees with their IDs, which many times leads to improvement in everyday working solutions. And then not at least, we're working together with wards in different innovation projects in order to create better quality and efficiency in the healthcare system. So that was the little overview of my company that I'm placed in. So coming back to today's issue, I mean, the basics of innovation procurement. And I've tried to point out a number of things that I think is extremely relevant to have from the beginning. And I would say that everything starts with going from an identified need to a prioritized need. And the question is many times, how do we reach that point where a need is prioritized? And I would say that the main thing is to secure top management commitment, agree early on economy during an innovation procurement. Preliminary implementation costs must be handled and discussed early on, engage staff and a responsible manager. And then when you have managed to get that support, you have the mandate to work with your prioritized need. You must do your homework, prepare, and build a strong case. So put as much effort and time as possible in the preparation phase. It's crucial for the following cases. And if you're not well prepared, you'll not be convincing towards the top management. Then it's extremely important to build the strong case, and you'll not be convincing, and you'll probably experience lack of support if you don't have the strong case with you from the beginning. So prepare, and then build a team. Relevant functions in the organization must be involved at an early stage, and stay function oriented, because many times persons would like to see solutions based on your challenges at the beginning. But if you start to work with solutions too early, then you end up in a very not constructive way. So avoid solution and stay function oriented. I also would like to highlight that it's important to agree on a fair description of the need and the functions that you have managed to clarify, and try to visualize it so everybody that are in your working team and top management can understand and get the picture of what shall be addressed in the coming innovation procurement process. And then also expect the unexpected. But you can handle unexpected things if you follow a structured process, which I'll show you in a couple of slides. But by following a structured process, you can handle different bumps and keep a steady course, even though you have to extend the time in some phases in order to be ready for next step. For example, test and demonstration can raise new issues to handle, legislation, effects on processes, which leads to need for adjustment during the process. And that comes to the next point here, to have a realistic time plan, because there are many steps before you enter the implementation phase. You need to handle development, verification, adjustment, validation, evaluation, integration, and a plan for implementation. So present and discuss and put much effort in finding a realistic time plan. It's also crucial. Then when you go out to different suppliers, you must understand how they work. And many times, many suppliers, they try to bring in existing solutions. So you must get them to realize that they actually need to develop and adjust their solutions during the innovation procurement. And a good solution contributes to better efficiency in everyday working processes. And I would say here, it's important to have a frequent dialogue with the suppliers and to create a joint development attitude where you don't start to point at each other. Because if you don't create a joint approach, you'll end up in a never-ending discussion of, is this good enough, or it will delay your process and in worst case lead to distrust and contradictions. I've experienced this many times, and the supplier just bring in more and more strategists and top level persons to discuss why it's not working and how it's supposed to be. So try to create that joint development attitude. And also, if you see that the project isn't really improving, everything is hard and it's a lack of interest from relevant parties, you shall not dare to shut down projects, because it takes so much time and it costs so much money. One last thing, you will be questioned and considered as a threat during the whole innovation procurement process. But when you're through, because when you're through the process, everybody will say it was a rather obvious solution. Because at that time, everybody understand the need area and they have been exposed to different solutions that have been worked out. So at that time, I mean, you can see rather clear on how to solve your problems. But from the beginning, it's hard. So you'll not be Mr. Popular guy from the beginning. Just prepare for it. Okay. I mentioned to follow a structured process, and my structured process is described in this model. And for me, these steps will always be covered, regardless what procurement procedure you choose. By the way, optimally, you shall not decide on procurement procedure too early. Preparations will lead you to a suitable procedure. Then you can discuss whether it's appropriate to use innovation partnership, competition through dialogue, negotiated procedure, ordinary procedure, competitive approach, PPI, or PCP, for example. So starting off in the exploring block here, you have to work with the organization's need. And I would say that The crucial point here is to, I mean, firstly, understand, are there solutions out there? Has it been developed elsewhere in the world? If not, how can I convince my organization in the extent so they actually back the proposed innovation procurement in a good way? And then we are on the issue of, should we suggest a priority? And I have a couple of things to say here. If the identified need goes along with areas of interest pointed out in steering documents or report, it will make life much more easier for you. Otherwise, you have to work hard to convince key players in the organizations to push on strategic person in order to get attention regarding your proposed innovation procurement. You must, to some extent, secure top management agree on the proposed case. They must allocate development funds and allow internal personnel to be involved in the process. Further on, they must be prepared to allocate financing for the coming implementation. So they must be prepared, involved, and they must, in many senses, own this process. But if you have the management attention and raise their awareness and get support, then you can enter the startup phase, and that's when the fun part begins. Because then you can go into working internally, build a team with relevant functions involved. And afterwards, you'll also realize that we don't have all the competence needed in order to get a clarified and defined need. So then you involve also external competence in your process. When you have a clarified and defined need, you can start to have initial dialogue with the market, arrange different workshops, and create an awareness in the organization of what's going on here and what kind of solution can we see in the future. And at this time, I would say, is from my perspective at least, it's appropriate to decide on method to use, and then you can go into a more competitive approach and involve different suppliers, work together with them during the procurement, and this is I would say that this phase take a lot of time, and it's a lot to handle here. When you have managed to go through this step, need owners have to prepare for implementation, and then you can have an introduction of the product or service in award, for example, and you can start to evaluate the effects in the business and evaluate financing, savings, cost savings, etc. Effect in the organization. And as you see down below the model, you see a lot of arrows, and it's just to highlight that it's needed that different functions in the organization take part in many different steps during this process. It's hard to sort of work with all these issues outside of the organization. I would say I would not recommend it. It's much better to involve them, all the relevant functions in the process, because it's needed. Okay, so one more time. You have heard me say prepare, prepare, prepare. And the thing is to go from a problem to a need to manageable need until a detailed need. Focus on understanding the need. Go through studies, interviews, understand processes. Illustrate the need. Create a common understanding among need owners, procurers, and solution providers. Prioritize the need in the organization and create a plan for development process and integration of new developed concepts. Use early market dialogue, where you describe the need and involve relevant sectors in this dialogue. So be open here and use a request for information or request for proposal in order to get the market detailed feedback on your proposed description. Have use dialogue in many and different ways. Deeper dialogue with all partners that, I mean, of course, you shall be open for everybody, but those who wants to participate and go into deeper dialogue. And after this, you hopefully you have created an innovative environment where the organization has learned on how to behave and how to handle a process like this for coming need areas to be addressed. So one more thing that I would like to point out. This is a slide from Region Skåne, and it's how they think of dialogue in all different steps. They work with dialogue in the need clarification phase. They work with dialogue in request for information and meetings, external consultation before launching a tender. When they're establishing procurement, they also use external consultation in order to adjust the tenders. And also afterwards, you can have follow-up meetings and get the thoughts from the suppliers of what worked out here, what was not good. And also, I would say that it's important that when you have went through this whole process, it's about to find an agreement with the supplier. And then that part can also be a little bit tricky, but we'll have to handle that issue another time. Okay, I was also asked to bring in a case and for learning, and I've choose to show you how we work with fall injury prevention in Region Skåne. We wanted to allow innovation projects to be developed in an innovation procurement process. The solution should clearly prevent fall injuries in the healthcare environment, and the project should define the target and exploit market innovative solutions to how this is done in the best way. And we also had an ambition that to reduce the number of fall injuries by 20%. And we were open for different solutions. And we early on, we also communicated that the best solutions were allowed to be tested out in 1 or 2 wards with about 50 patients. We worked, as I have described earlier on in this presentation, with shaping a team consisting of persons with different knowledge background to create the best possible conditions for deep understanding. We engaged stakeholders. We created open invitations to the market and stimulate new solutions to be developed. We used competitive tendering, which was possible in a number of steps during the innovation procurement. And then we enabled try, test, development, and verification during the innovation procurement. And finally, we enabled test in a healthcare environment and had a plan for full-scale implementation, which will be the case actually at one new hospital being built in Malmö, where they have this solution in mind now when they build up the rooms. So I would say here that we managed to attract a lot of suppliers. We had from the beginning 13 consortia of companies that placed a bid. And then we used different cuts. And the final step, we had 3 consortia working out and developed and tried out new solutions. And at the end of the process, we choose the best solution. And when I say we, I must clarify, that is Region Skåne is the procurement body. So we, Innovation Skåne, has been involved and we have helped out during the process, but it is Region Skåne that is the procuring body. We used external service design consultant in order to illustrate 3 different scenarios where fall occurred in a hospital room. We created personas and described in brief the background of the patient, medication, medical history, age, time at the hospital. The scenarios formed the basis for evaluation. Companies could choose one scenario as a starting point for their solution. And using this method, it was much easier for the evaluators to rate the different proposal on equal terms. And it was interesting to see how the suppliers actually worked with these scenarios, and the scenarios helped them, and the personas affected on how they thought of their adjusting their technical solutions and so on. One family picture, or almost, from Region Skåne. This is at the ward in Malmö, and I choose to show this picture because it illustrates that you have to have many partners involved during the whole process. Here we have a person from the IT department, of course, Procure Lotta here, closest. And then we had from quality department. Closest to the picture, looking a little bit scared, is the director of Region Skåne. And then I'm sitting there, and we had a manager of the ward and staff. And this kind of meetings was so important because then the management of Region Skåne, they could come, they could discuss, and they could encourage the ward and the staff that they're actually doing valuable efforts for the organization. And it's also a little bit fun for them because normally a day isn't a lot of hard issues to handle. So create that atmosphere. At the end of the process, we chose one solution, and it consisted of bedside equipment where we could have a continuous follow-up on vital parameters. And all that data was sent into analysis motor, where we could have an overview at the ward of the different patients and their risk judgment. When the system notified a risk, or when it was identified a risk, there was a notification to personnel. And many times this was 10 or 20 seconds before something should occur. And then they could come in and help the person, because many times it was they wanted to go out of their bed, or they needed to go to the hospitals or hospital. They needed to go to the bathroom or something like that. And then we also demanded that it should be possible to have a journal integration of the system. It says here development in process. It has been fully developed, and now it's just about implementation. This project. Okay, one last slide. I hope I kept my time rather okay. I'm looking at Magnus here. Okay, but it's just to show that innovation procurement can sometimes be very demanding and hard to perform, but it can also be, you can also allow innovation in a much more frequent way by thinking a little bit new, and I'll describe how. In the top of this pyramid, we find the highest innovativeness level. Here you find the procurement of innovation, or PCP processes or such. There are no solutions available on the market, and we need to go into the process that I've described in order to create an environment where new solutions can be developed. The second level of the triangle, I named that as a strategic innovation-friendly procurement. It's the middle segment, both regarding number of cases and innovativeness. The result can be here in this level, a new product with strategically important areas, such as within healthcare, decision support programs, and related to environmental areas, replacing plastic disposable items or something like that. So when you have like a strategic mission, and it will help the organizations a lot, I would place that kind of procurement here. And then the third level, that's the largest part of the triangle, which has the lowest innovativeness level, innovation-friendly procurement. Here, we define innovation-friendly procurement to be open towards new products and entrepreneurs. The result can be a new product, obviously, but in order to enable this, we can, for example, split up certain contracts in order to open up for small suppliers, small companies. We're at Region Skåne, they have tried to simplify the procurement documents in order to lower the input thresholds. You can always challenge your demand, delete demands that are not necessary, and some demands are necessary, but you can also think that for some companies it can be handled within the first agreement period. So, I mean, to close down my presentation, I would suggest that try to be open for innovation. Of course, use interesting methods and work hard with and challenging, but allow innovations to take place in your organization. Thank you very much.
Thank you, Björn. Thank you very much for your presentation. So it was very helpful, I think, for everybody that is now today here with us. And now it's the turn of my colleague Magnus. So Magnus, the floor is yours to introduce everybody the call for trainings that we are planning to launch shortly.
Thank you, Maria, and thank you, Björn, for your great presentation. So I'm a colleague of Björn's here at Innovation Skåne. We are partners in the Procure4Health project, and with this following presentation, I'm going to focus a bit more on one of the opportunities that is being made available from the Procure4Health project, one that was also mentioned briefly by Maria in her introduction to this webinar today. So you have all heard about the Procure4Health project, and this would be the consortium that we're working with. I think that when it comes to the call for twinnings that will be briefly introduced now, this focuses very much on the capacity building part of what we mean to offer from the project, not only for all project participants, but also to any type of procurer active all over Europe. So I think that as suggested by Maria, we need to understand capacity building of in innovation procurement as covering a series of steps on the way to the successful deployment of an innovative product or service in the organization. As also Björn described, there are overall, you could say that this process consists of 4 major steps: exploration, understanding the definition of the procurement path and building the process around it, going into the actual collaborative development with a supplier or a number of suppliers, and then having the resulting services deployed and achieving the full impact of what was the original purpose and the need defined by the procurement. Each of these steps, we would say, we believe, have had its own logic and purpose, and to fully understand the innovation procurement procedure, each of the steps also need to be understood in itself. We provide different tools from the project, and what we will be focusing on today is what we call for twinnings being made available shortly by the project. The twinnings in itself is a way to offer increased capacity in innovation procurement, and going back to the steps on the previous slide, this could mean the opportunity for a procurer or an organization to understand better one of the individual steps and the questions that need to be understood, addressed, and answered within those individual steps. For instance, as mentioned here, as part of the exploration step, procurers must understand and clearly define what would be the unmet need. There needs to be kind of a market exploration or market dialogue, understanding what is currently available on the market, going all the way through the collaborative development onto actual deployment of the resulting products. All of these questions in each step of the process must be understood and resolved during the process. And this is what we are trying to support procuring organizations in doing by, for instance, this Twinnings call that we are offering. So what is the Twinnings call actually? It is the opportunity to engage in a number of activities between 2 partnering organizations to understand better these questions that arise during the process, and not only, and by doing that, highly tailored activities needs to be defined. It can be defined during for the partnership, and the successful applicant will receive up to 30,000 euros for implementing these activities and thereby increasing their capacity in the process in itself and in innovation procurement as a whole. But what does that actually mean? It means that for an applicant to be eligible for these Twinnings opportunities, they need to identify a suitable Twinnings partner, another procuring organization typically. They need to discuss and define joint activities for knowledge exchange and capacity building. These details are all part of the documentation that we will release shortly, but to understand a bit better, we are including examples of what those activities can be, but not necessarily need to be. They can be arranging shared workshops. They can mean joint travels to meet other partners that might be strong in the domain. Study visits to organizations that have previously implemented such procedures, being able to conduct situational analysis or a market analysis around a specific unmet need that they might have, other types of costs for external consulting and services to be able to move one step ahead in the procedure. And what is meant to be said at the bottom of the screen is to say that indeed these partnerships can be designed in many different ways. They can be designed by one very strong and experienced actor partnering up with someone else with less experience but are very curious to know more. They can also be two, let's say, equal partners with similar types of experience or complementing each other, which would mean kind of a more bi-directional partnership, so to speak. Both of those would be fully aligned with the purposes of what we mean to do with these twinnings. So how would organizations or procurers submit an application for these twinnings opportunities? Once you've identified suitable partners, you've defined what you mean to do within the twinnings opportunities and the activities that you'd need to take on or approach during the twinnings period, then these partners need to submit a joint proposal in the call. And I see that the text is cut here, but as Maria mentioned in the introduction to this webinar today, all of this is done on the Procure4Health community platform, which you also saw the link to earlier. So this is all to just say that these call for twinnings opportunities we plan them to be launched next week, and the news will of course be disseminated to all stakeholders or people that have in one way or another approached or shown interest in the Procure4Health project. As Maria mentioned, the community platform of Procure4Health has already been launched, and this will be the main communication channel and main platform for also submitting your proposal for the call for twinnings call. So we just want to encourage you to visit our website at procure4health.eu, register and go to our platform. And then as the call is launched, you will receive all of the news relevant for your application. And most importantly, we expect the deadline to be end of May for applications to be submitted. And I think that is all for us.
Thank you, Magnus. Thank you very much for your presentation. And we hope that a lot of attendance today will be interested in our training call, so we will keep them informed when it will be launched, but we can confirm that next week it will launch for everybody. And now just 1 minute to share my screen because I want to mention yet one key next activity. So yeah, so to keep you informed that as Manu mentioned, the call for training will be launched shortly next week, probably. So you will keep yourself updated if you register to our platform or subscribe to our newsletter. And the other important event that we will come in soon is the second international conference for hospital directors and management. So Procure4Health community is co-organizer of this conference that will take place in May, 10 of May in Krakow. And we will have a lot of experts from all over Europe. and they will be presenting their experience on innovation solution. So we invite you to register, and I hope to see you there. So this is the other, the upcoming activities of the Procure4Health community. So if you want to keep yourself updated and don't miss anything, you can subscribe to our mailing list, accessing our website. Yeah, that's all from my side, and I think that now we are a bit of time, but we want to give you the time. Sorry, yeah. No, okay, so you are seeing my screen, yes. Okay, now is your turn, and so you are invited to launch your question in our question and answer box. So I think that there is already one question in the chat. So I try to have a look. Björn, you answered the question. Okay, so okay. The idea was to talk with, yeah, to answer the question in front of everybody. Okay. So in case somebody else has the same question. So if you can.
Yeah, of course, I can tell you also. We used the competitive dialogue when we worked with fall injury prevention.
Okay, so.
And I would also say that both me, Magnus, and Fred, we will be on spot in Krakow for the next meeting. So if you like to go into like the detail and have a little more discussion regarding how to use and how to choose different procedures, we're more than open to have that discussion with you there. Or otherwise, you can also like write me an email or something. Yeah.
Okay, perfect. Thank you, Björn. So I don't know if somebody else has any question. So we just received this one. So just to remind the question for those who have not heard the question is, which procurement procedure did you use for the FALS project? So this was the question.
And now we have another question. It was about if we worked with the PCP before the competitive dialogue. No, we didn't in this need process, but I would say that we worked almost 1 year with preparing ourselves before we entered the competitive dialogue. So we did a lot of work in order to prepare ourselves and also to be relevant when we were out discussing with the stakeholders and suppliers.
Yeah. Okay, thank you, Björn. Somebody else wants to ask something to Björn or to Magnus? Okay. So I want to learn Björn. So what are the benefits for Innovation Skåne as for being part of Procure4Health community? What do you think that is what do you get from this Procure community?
I would say that we get an international network where we meet other organizations that work as we. Sometimes we identified common need areas, and then we don't have to do exactly the same processes in parallel, so we can work together. I would also say that, I mean, we have some experience, but then we meet other experts that are that have so much experience from one one typical area, and then we would like to have exchange of knowledge with them. So because it is hard to work with innovation procurement, and you really have to encourage each other and help each other forward. And I mean, learning from each other is crucial. So learning, sharing, and encouraging.
Yeah, okay. So fully agree with you, Björn, because it's important to not to repeat the same processes, because there are already organizations that have been working in the procurement of innovation, and now it's time to gather all our experience and to move forward on the innovation procurement process, and transfer our knowledge and share the experience we have.
I would actually, Maria, I would like to add one more thing.
Yeah.
And because for me, we meet a lot of different suppliers and innovative companies, and sometimes we get the notice of innovation procurement going on in other countries, and then we can direct them to other countries. So that's also a very good thing working together here, that we get to know about hopefully about the different innovation procurement projects that are about to be launched.
Yeah, this is another of our objective in this community, because we are 33 partners from 15 countries. So it's nice to share the experience from the other regions, and to know what they are doing in the regions as well. So I think that this is the key aspect of a great community of procurers sharing and sharing knowledge and sharing the experience like before. Okay, so if nobody has any more question, I think that we can conclude the webinar. And if you have any question, doubt, or you can go further on this, you can contact us, contact Innovation Skåne team, or contact me. So it's we will be more than happy to help you and to meet you if you need to know more about our community. And we invite you to join the community and access to the platform, because there you will find everything that we talk about today in our webinar. So thank you very much, everybody, and see you in the next webinar. We don't have set a date yet, but we will keep you informed through our means, through our Procure4Health social media and newsletter and so on. So keep yourself updated, being part of our community, and see you soon. And thank you very much, of course, Magnus and Björn for being part of this nice webinar. So it's very nice to work with you.
Thank you.
Thank you very much.
Bye-bye.
Bye.